Hi my dog lovers, hi, this is Dr. Dobias here, and I am here today to explain one of the most stubborn conditions in veterinary medicine. In fact, I've read some research and articles, and some dermatologists consider this the worst nightmare, even though it is not life-threatening. The condition is called acral lig granuloma, or in short, lig granuloma, and it is caused by dogs obsessively licking a piece of skin either on their forearms or feet or hind legs and feet, and they basically rip all the hair out and make a big bald patch that is thickened and inflamed, and sometimes there's bacterial infection. The conventional approach to treatment is preventing your dog from licking, which is some sort of bitter apple spray, using creams, using anti-inflammatory topicals to make sure that the area is not inflamed. Sometimes treating secondary bacterial infection, doing biopsies and covering the area up, and making sure that your dog doesn't lick. Similar to other colleagues, I have ended up with many failed treatments and many failed cases. And until about 10 years ago, I thought that lig granuloma was actually a very difficult condition to treat. But because I'm stubborn and curious, I started looking at other possible causes, thinking, dogs are smart, they're naturally happy. They're very seldom obsessive compulsive. If you think of your dog, it's very unlikely that he would just kind of pick one patch of skin and start licking it without any reasons. I thought, okay, maybe dogs have some sort of abnormal sensation. What could cause abnormal sensation? Fleas, parasites, but most of these dogs have been checked for parasites and fleas, and there is nothing. Then I thought, okay, what do people feel when they have some sort of abnormal sensation? Well, when they have tight neck or tight back, they may have pin and needle sensation in their feet, in their arms, in their hands, fingers. And what if dogs feel the same way? What if the original cause or the primary cause of lig granuloma is some sort of neurological abnormality or sensation that they feel, and they're trying to get rid of it? So I studied the nerve lines for the spots where they appeared, and realized that they actually often end up in the lower cervical area where the collars get placed. Knowing that most dogs actually pull on a leash, it was very easy to kind of figure out maybe this is a collar injury. Maybe if we remove the collars and treat an affected dog by chiropractic treatment and releasing the muscle spasm, maybe doing some massage, physiotherapy, osteopathy, any kind of release technique, maybe these dogs will start improving. And to my shocking surprise, they actually started improving, and a large majority of these dogs stopped licking. So you may be thinking, how about hind legs? What if my dog licks hind feet? How does that apply? Well, it's very simple. Many dogs have lumbar spine issues, lumbar muscle tightness. And the tightness results in the same symptoms like on the front feet and legs if there is muscle tightness around the neck. The only difference is that this time it's at the lumbar spine, and the lumbar spine supplies the nerves to the hind legs and hind feet. So if your dog licks around the hind feet and has lig granuloma there, you should be looking at the lumbar spine. As time progressed, I developed a really simple to follow plan for acral lig granulomas in dogs, and realized that most of them can be treated quite easily if we address the primary concern, the primary cause of the condition, which is cervical spine injuries and also lumbar spine injuries for the hind legs. Number one, make sure that your dog does not wear a collar attached to a leash. So if you take your dog out, make sure that he or she has a harness. If you like to put a collar on just for the little identification, make sure that it's not too tight and that you put at least 2 fingers under the collar, nice and loose. If you're worried that your dog will run away without a collar, well, you have to use a harness and you have to leash him, but do not use the collar. Obviously, shock collars, any choke chain, any prong collars are even worse than regular collars. But the number one step is do not use a collar for a dog that has acral lig granuloma on the front feet, because the nerves are supplied by the cervical spine. Number two, make sure that there is no sliver or foreign body in that particular area. Actually, that should be almost number one, but I forgot about it, so I'm putting it as number two. Number three, make sure that there are no fleas or parasites, because your dog may be licking because simply he or she has fleas. If it takes some time for the irritation to settle, I recommend that you protect the area by a bandage. You can also saturate the bandage with skin spray, which can be found on our website. What I usually do is to just use a piece of gauze and then wet wrap, which is the elastic 3M bandage. And you can saturate the bandage with skin spray, which is a herbal formula for skin healing. It will reduce the swelling, reduce the inflammation, and calm the area down. Now, if your dog tears the bandage off or has the habit of tearing the bandage off, you may want to use the cone, but that's the last resort, because dogs don't like to wear collar and we don't like seeing them with a collar. So, that's the last resort. I'm not saying that you should never use them, but it would be advisable to try the bandage first. To reduce the inflammation, I recommend that you try CBD oil, and the dose is 0.1 to 0.25 milligrams per pound. Now, you start with the lower dose, 0.1, and get to 0.25. And of course, the last thing that you may want to consider is to make sure that your dog has enough building blocks to heal, that the skin has building blocks to heal. So make sure that you add essentials, that you feed your dog either cooked or homemade raw diet, and if you can, skip the kibble, because kibble sits on the shelf for 6 to 12 months, it oxidizes, and it is not good for anyone anyway. If you have any questions, you can go to peterdobias.com and send us an email and join our community. Make sure that you don't miss any of these educational videos and courses, because I am busy, I like to be busy, and I like to record to empower you and make sure that you can keep your dog healthy and happy for many years to come. Have a wonderful day. Take care. Bye.